Cuboid syndrome is not something that you're going to see very often, but I can tell you from personal experience that it can happen in very crazy ways. Uh, Very quickly, one time I was vacuuming the stairs and I had left the vacuum at the bottom of the stairs, had gone upstairs for something, and then on my way down, I misstepped somehow and I tried to avoid the vacuum and I felt a pop in my ankle. And I thought, oh, great, I just broke my ankle. Got up, was able to walk fine, but I had a lot of point tenderness on the lateral side of my foot. Didn't think anything of it because I was able to walk. Well, later on, and when I say later on, several months went by, still having that point tenderness, but no other problems. I misstepped off a curb, felt another pop, and when I went to check it, all the point tenderness was gone, and realized when I went back and taught this the next year that I had probably subluxed my cuboid. So, cuboid syndrome, again, not common, but it definitely is something that you may encounter in your career. So, let's talk about the cuboid for just a minute. If you think about the cuboid and where it's located, it acts as the fulcrum of the perineal longus pulley. Think where your perineal longus is. It originates in the upper two-thirds of your fibula. It passes posteriorly to the lateral malleolus, and then it follows kind of an anterior plantar direction until it reaches the cuboid. Then it changes to an anterior medial direction and eventually attaches to the first ray. So that perineal longus can displace the cuboid dorsally, resulting in the medial aspect plantar flexed and the lateral aspect dorsiflexed. Let that sink in for just a few minutes. Think about the mechanism of what your perineal longus is doing and how it will displace that cuboid. Again, the cuboid ends up with the medial aspect plantar flexed and the lateral aspect dorsiflex. So what are the signs and symptoms? Well, first of all, 89% of the people who have this problem generally have pes planus. So that's one thing that you want to take a look at. The lateral midfoot edema is going to be at the cuboid. There is going to be lateral and plantar surface pain over the cuboid, and then you will have a point tender perineal longus. Problem with that is oftentimes that will be misdiagnosed as tendinitis. Now, let's think a minute about that pes planus that I mentioned. If you've got pes planus, you've got some unstable mid-tarsal joints. This means that the perineal longus has a greater mechanical advantage. Therefore, it's actually easier to displace the cuboid because the fulcrum of the perineal longus pulley can displace that cuboid dorsally. Having that pes planus really puts you at a disadvantage for having this syndrome. Range of motion is going to be normal for the most part with foot and ankle movement. However, that normal tarsal-metatarsal glide is disrupted there at that cuboid joint. There really aren't any special tests, although with that direct palpation, you're going to be able to determine that there is a little bit of a deformity going on there. Manual muscle test may show that you've got some perineal longus weakness. A differential diagnosis may be formed, such as a stress fracture or that perineal longus tendinitis. But again, those things need to be ruled out because the cuboid is technically displaced. Treatment-wise, there can be a direct manipulation for a reduction. Honestly, I have never seen anyone perform this reduction, and I'm sure there are a lot of athletic trainers that have. I, however, have not. If the person has a lot of problems with subluxations taking place, they may also be placed in orthotics.